doctors who treat scoliosis in adults. Scoliosis can affect any age group, but it's most often associated with children or adolescents because most people think of something called adolescent idiopathic scoliosis, which is by far the most common type, which we'll talk about in a second. But unfortunately, scoliosis affects all ages, including adults, because these adolescent cases will eventually become adults, so they have adult scoliosis, and there's also different types of adult onset. The different types of scoliosis, like I said, is most prevalent as adolescent idiopathic scoliosis. This is typically diagnosed between 10 and 18 years of age. Idiopathic means no clearly associated cause or no singular known cause. It means the person is otherwise considered healthy and they develop scoliosis for some reason. 80% of all cases are classified as idiopathic. Now, the other 20% are associated with causes, and this is something called neuromuscular scoliosis, something called congenital scoliosis, degenerative scoliosis, and also traumatic scoliosis, which can also be related to degenerative, and I'll explain why. Now, the most common type to affect adults is idiopathic. Idiopathic scoliosis is by far the most prevalent, and the most common is the adolescent case that either was diagnosed or undiagnosed is now in the adult form. Now, the second most common type is something called degenerative scoliosis, and this is where adults develop scoliosis. It's also known as de novo scoliosis. Now, idiopathic scoliosis, like I mentioned, is the most common type, is the adolescent who now is in the adult. They either received a diagnosis or didn't receive a diagnosis. Now, a lot of patients don't understand is that why didn't I know I had scoliosis as an adolescent if I have it in an adult and now it's causing me pain or discomfort? Because pain is the most common symptoms that brings out treatment for scoliosis in the adult form. Well, the problem is that in adolescent form, what's causing the curve to develop and progress is growth. And since growth is elongating and not compressive, it normally doesn't cause much pain or discomfort. In fact, many kids with very, very severe curves have no pain or no discomfort as a result of their scoliosis. The biggest scoliosis I've seen in a child has been 155 degrees, and that child had no pain. Now, unfortunately, the opposite is true in the adult stage. As adult curves progress, they progress as a result of compression over time, as a result of gravity, and this compression will eventually lead to pain. And therefore, this pain is what brings on the diagnosis. So some of these patients actually, if they knew they had scoliosis, discount scoliosis as the reason of their pain because they said, I've had it my whole life. Why is it causing me pain now? It's because how it's progressing in the adult form is different as a child. Unfortunately, some curves that are small enough and they never get diagnosed, meaning curves less than 25 degrees or 30 degrees, or maybe they develop after the growth phase, after the age of them being checked, because remember, curves progress during growth, and all kids get checked around 12 years old, and they don't get checked as often as they get older, and they have a late growth spurt and the curve develops. They often go undiagnosed, and then they have pain, they go get an x-ray done, and they find out they have scoliosis. This is by far the most common type. Now, degenerative scoliosis is actually scoliosis that develops in the adult stage. We do not see degenerative scoliosis in children because degenerative scoliosis means the spine is degenerating in an abnormal way that's leading to a curve. Now, often scoliosis in the degenerative form is often referred to as, oh, it's just happening because of natural age-related degeneration. Well, that is not true, because when you look at the area of the degeneration of where the scoliosis is, this degeneration is more extensive than the rest of the degeneration of the spine. So what we believe happens is something causes a small misalignment in that area, either young in life, young adult, or even in childhood, but it remains uncorrected, and this uncorrected or misalignment leads to an uneven deterioration of those joints, which causes this curve to progress. These curves can become unstable as the curves get bigger, but they also more likely lead to pain. The most common onset of pain is somewhere around 40 years of age, and it's more common in women due to body changes in bone density, typically around menopause. So we see it around 50 or so where it starts to accelerate. Now, what's interesting is that these spines where degenerative scoliosis occurs, and you see this extensive amount of degeneration occurring in the adult form, this is also true in the adolescent form because scoliosis is also progressive, meaning the adolescent case that's now moving into the adult will also progress. Even though growth is by far the main progressive trigger, adult scoliosis still progresses. but it progresses much slower. So in an adolescent stage, as curves are progressing, this idiopathic scoliosis can progress very quickly. Well, we don't see rapid progression in the majority of the adult life. It is slow and steady. I always kind of say it kind of snowballs. It kind of goes off really slow and steady, and then it starts progressing its rate as the patient gets older and as the curve gets bigger. So the biggest factor in how fast your curve progresses in the adult form is actually the size of curve. So if every year your curve is increasing in size, say only a degree, well, if it's increasing every single year 1 degree, in 10 years it's 10 years bigger. Now the curve, let's say, goes from 30 to 40. Well, now a 40-degree curve progresses faster than a 30-degree curve because gravity affects it more. So it starts to accelerate. We tend to see between 20 and 40 years of age in idiopathic cases that the curve progresses very linearly. Then somewhere between 40 and 50, normally it starts causing pain and discomfort, and then we see the rate of progression tend to increase. It increases earlier in women. It tends to increase around 50 to 55, the rate of progression. In a male, it's more like 60 to 65, but it tends to increase its rate, and once it starts increasing its rate, it continues to increase its rate as the curve gets bigger and causes more damage. In degenerative scoliosis, it's very similar. It progresses very, very slowly and steady as it begins to deteriorate and cause pain. Somewhere around this 50 years of age, it starts to increase its rate of progression. The degree of progression, unfortunately, is unpredictable. It can be anywhere from a half a degree to 2 degrees to 3 degrees. In later stage life, we've seen curves change 10, 15 degrees a year, like in 70 plus years of age, with curves that have accelerated their rate of progression relatively significantly. So the idea is to treat a curve before that progression starts to happen quickly. However, if you don't treat a curve or you don't deal with it proactively, this slow acceleration builds up speed, and you start dealing with some more significant progression. And in this stage, you're dealing with a bigger curve, a stiffer curve that's always harder to deal with. Now, adult cases can respond to treatment, but the smaller the curve, the younger the adult, the better the response. Now, unfortunately, the majority of patients I see, especially the adult forms, are typically 40, 50, or 60 years and older, and we're dealing with more significant issues. Now, if I see a younger adult, it's typically because they know they have scoliosis, and they normally want to improve their posture and the shape of their body as a young adult. Now, in patients that are older, what we find, if they come in, they're 40 and 50 and they have pain, and we can reduce the size of curve back to where it was before their pain started. So let's say they knew they had scoliosis and they're having it evaluated, and then at 40 years of age they had no pain and they had a 40-degree curve, and then at 50 years of age they have a 45-degree curve and now they have pain. The good news is that we don't have to get the 45 to 0 to make them feel better. We get them 45 back to 40 where they had no pain. That's where our goals are, because if we get them back there, a lot of times they improve what they're feeling. So normal adult patients, we don't have to correct their scoliosis completely. We just have to reduce it back to where it was, where their problems were less painful and causing less issues. And normally we can see a significant improvement with their function and pain. So the idea would be is the sooner we do that, the more likely we are to achieve that goal, where if you start feeling pain at 40 and then you leave it 20, 30 years and it's progressed 30, 40 degrees from that time, well, that amount of change that has to occur may not be possible if you wait too long. So therefore, working on preventing spinal progression and scoliosis progression is by far the most important treatment. The treatment for adult scoliosis is very similar to adolescent scoliosis. It needs to address the spinal curvature at the core, meaning at the structural level. This helps preserve spinal function. This helps increase spinal strength and stability. And most importantly, by reducing the size of the curve, it slows down the progressive nature of scoliosis, because the smaller the curve, the less likely it is to progress. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.